Haldol or Haldol is a common medication that is used to manage symptoms for the hospice patient. It's an old medication that has been around for many years. It is the medication in classification of antipsychotic, and for people who have been in the healthcare industry for 20 to 30 plus years, it has a reputation of being known as the crazy person's drug because it was and still is used to treat extreme agitation and delirium. Its use has waned for many years. Well, Haldol is back in vogue, and it's used very differently and effectively in the palliative medicine and for the hospice patient. Since palliative medicine, Haldol is being used in a very small doses, anywhere from 1/2 to 2 milligrams for symptom management for the hospice patient. So what are the uses for Haldol in the hospice patient? It is used to treat anything from irritation and anxiety to severe agitation and delirium. For most people, the idea of taking an antipsychotic medication sounds kind of scary, and honestly, the old-timers in healthcare can be quite resistant to it until they become orientated with it in a new context. So here's my spiel on Haldol when I introduce it to patients and families for use. I always start by acknowledging upfront that Haldol is an antipsychotic medication and that it has been around for many years, but now we use it in tiny doses and differently, and it gently helps people and patients feel more settled. It is my favorite medication in our comfort pack, and when it's my turn, I'm going to want to use it. I go on to explain that as humans, we all have that wheel that spins in our brain. Haldol works by just slowing that wheel down just enough to step off for a while and take a break. It generally isn't sedative, but it does help with sleep because it helps by letting the brain rest and allowing us to go to sleep. I find it is also helpful for that kind of irritability that you just can't get away from, which is common for the hospice patient. And let's face it, there's a lot to be anxious and even irritable about when we're facing the end of our life. At this point, families are often saying, "So, sounds like I need some." Of course, that is not an option. Haldol can also be very helpful for more severe anxiety, agitation, hallucinations, and delirium, which again can happen for the hospice patient. Other symptoms that Haldol is good for is nausea and vomiting, and even chronic itching. Haldol is now a standard in hospice care, and most hospices include it in their list of medications for comfort care. It's important to know that it is a prescribed medication that is ordered by a physician, usually the hospice doctor, and the hospice team will give you clear directions on how and when to use it, including route, dosage, and timing. It may be scheduled, or you may use it just as needed. I'm not saying Haldol is for every hospice patient. The fact is you have to try it a few doses and find out if it's a helpful tool for you or the hospice patient. My point to this is that try Haldol if your hospice team offers it as a comfort measure. If you don't like it or it doesn't work, you simply don't use it. Haldol is not addictive, so it can be started or stopped anytime. There are some disease processes and medication interactions that make Haldol not appropriate for you, but your hospice team is responsible for letting you know that, and they won't offer it if not appropriate. Please visit our website, thehospicecareplan.com, to get a copy of our booklet guiding families how to care for the hospice patient at home, and go to our free YouTube site, the Hospice Care Plan, where you can get over 400 free videos like this demonstrating care and symptom management for the hospice patient.